Hey, what's going on? Okay, so I've had a lot of questions about, how do you start T? What is the process about going about transitioning? And so, Jackson the Rabbit made a video on this. There's what they call the informed consent method, which requires no therapy, no letters or anything. And then there's the therapy and letters route. And I'm going to go ahead and expand on that a little bit. There's what they call the Harry Benjamin Standards of Care. And it's this prescribed route for doctors to follow. And a lot of them don't follow it to the T, thank God. And I really think that they're a crock of crap. But thanks to frivolous lawsuit Happy America, doctors have to protect themselves. So they invented this. The first thing that I find pretty entertaining is that when you look them up, the clinical version, one of the first, they discuss some terms and whatnot, and on here it says, 2 primary populations with GID exist, biological males and biological females. Really? No shit, Sherlock. Okay. So, they talk about what's required, and it goes through, diagnostic assessment, psychotherapy, the real-life experience, and hormonal therapy, followed by surgical therapy. And it goes on to say that, the roles of the mental health professional with the gender patient is to work with them, and it goes on to, say that they have to diagnose that they have GID, and then make sure that they don't have any what's called comorbid disorders, meaning, something else wrong with you, making you think you're trans, but you're really not. Some patients end up actually being schizophrenic. Some patients who think they're trans end up having some form of multiple personality disorder. There was an individual here on YouTube somewhere that's the case. So that was a pretty interesting revelation. But anyway, so it goes on to say the therapist, diagnoses them, counsels them, and make sure that they're ready for hormone therapy, followed by making sure that they're ready for surgery, and then writing the letters for that. They recommend that, basically, according to Harry Benjamin, you're supposed to undergo 1 year of therapy after having been diagnosed as GID to confirm that you do in fact have GID or some variation thereof. And then you're supposed to live for 1 full year full-time before they write you any letters for hormones. Okay, get real. Have any of you seen my intro video? There's not a chance in the world I could ever pass talking that high. Yeah, right. And that's the case for a lot of people, and especially, can you imagine the male-to-female people trying to live as female pre-hormones for a year? That's a death sentence here in Texas. Are you kidding me? So anyway, back to what I was saying. It goes on to state that, 1 letter is required for hormone therapy, and that it can be from an LPC or a PhD. LPC is licensed professional counselor. That's somebody who has a master's degree, whereas the PhD is obviously a doctorate in psychology. And according to Harry Benjamin, 2 letters are required for surgery, one of which has to be a PhD. Now, most top surgeons will take a letter from your counselor, be it an LPC or a PhD, just one. Dr. Raphael took the letter from my counselor, who is an LPC. She's one of the main counselors here in DFW for transgender people. So, and then it goes on to discuss, treatment of children and treatment of adolescents. According to Harry Benjamin, you cannot start hormones until you are at least 16 years of age, and that's with parental consent and a whole boatload of letters and certifications. I mean, if your parents are on board, it can be done before you turn 18, but you have to have both parents on board. They both have to sign release forms, even if they're not married. I've seen a couple of younger guys here on YouTube, so if you're under 18, you might want to try and get a hold of them if you have any questions about how to do it before you're legal to do it on your own. Hi, Monster. Yes, I see you. Oh, I see you. It goes on to discuss, what hormones should be prescribed to MTFs and FTMs. It goes on to talk about, hormone blockers to delay puberty in the children and adolescents. Let's see. Anything else interesting in here? Yeah, this section here on the real life experience. It says, since changing one's gender role has an immediate, profound personal and social consequences, the decision to do so should be preceded by an awareness of what these familial, vocational, interpersonal, educational, economic, and legal consequences are likely to be. When clinicians assess the quality of a person's real-life experience in the new gender role, the following abilities are to be reviewed. And this is another issue here. To maintain full or part-time employment. What happens if you want to be a stay-at-home dad? If you're stable in a relationship and have kids and you're a stay-at-home dad, according to this, you can't transition because you have no desire to maintain full or part-time employment. It says to function as a student. Okay, what happens if, you're my age, 22, 23, and you don't want to go to school, Here you go. To function in community-based volunteer activity. Let's be real. How many people do volunteer hours? Really? Yeah, no. College students do because we have to graduate. If you're not in college and you're my age, do you do volunteer work? Probably not. To acquire a new legal first or last name. To undertake some combination of items 1 through 3, which is the maintaining a job, functioning as a student, or to function in a community-based volunteer activity. Okay, it's possible that 1 through 3 are not options for you. If you're a stay-at-home dad, do you have time to do any of that? Yeah, right. And then it says to provide documentations from persons other than the therapist know that the patient functions in the new gender role. What, are you going to get your friends to write letters? Yeah, right. These are my problems with Harry Benjamin, but this is what it states. And once again, a lot of therapists don't rigorously subscribe to these. That's one question you should ask your therapist when you start. How fastly do you adhere to the Harry Benjamin standards of care? It goes on to list requirements for genital reconstructive and breast surgery for anybody. And it goes on to say that you have to be on your hormones for 12 months. Obviously, I've only been on them for 6 and I've had surgery. 12 months of continuous full-time real-life experiences. Periods of returning to the original gender may be indicative of ambivalence about proceeding and should not be used to fulfill this criterion. Ugh. Yeah, that's the short version of it. So I mean, like I said, not all doctors subscribe to these beliefs completely, but that's the basics. That's whatever. If you've got more questions, please feel free to ask me about my experiences or any other guys here on YouTube. It seems that most everybody here is pretty willing to help and answer questions. So, I'll catch y'all later. Bye. Little one, you gotta move again. Hey. Buzzface. You gotta get down again. Good girl.